Another thing that I wanted to talk about is dairy products. There was a study with 83 patients with a diagnosis of Hashimoto thyroiditis, reported that the prevalence of lactose intolerance was 75.9%. That's really high. And so people with lactose intolerance are unable to fully digest the sugar in milk, which is lactose. People have generally believed that milk is one of the most important parts of a healthy diet, with multiple health claims such as it strengthening your bones and helping cognitive function. And while milk does contain important nutrients such as phosphorus, vitamin D, and protein, unfortunately, there are some studies reported that cow's milk protein might be among the most common food allergens that are impacting young infants, children, and adults. Several authors reported that the problem might not just be mediated by the IgE antibodies, which is the allergic reaction to cow's milk and its protein, but that the early consumption of milk as a foreign liquid secretion from a completely different species might also increase the risk of developing autoimmune diseases. There was a review study published in 2021 concluded that dairy foods do not increase concentration of biomarkers of chronic inflammation. However, interestingly, lactose-restricted diet for 8 weeks led to a significant reduction in levels of TSH in patients with subclinical hypothyroidism and improvement in thyroid function. There are multiple studies that have reported much higher levels of IgG and IgA antibodies against milk proteins in individuals suffering from these following diseases in comparison to normal or healthy controls. Now, this is not to say that every patient would develop an autoimmune reaction to milk, but some individuals might. A variety of conditions from autism, celiac, Crohn's, multiple sclerosis, rheumatoid arthritis, lupus, type 1 diabetes. And this is not discussed anywhere, unfortunately, in the conventional medical community. If you want to read more about those, here are the resources specifically for each one of those conditions, so you can dive deeper into the ones that are most interesting to you. So lactose intolerance is not limited to patients with chronic conditions. It's estimated that 75% of the world population is intolerant to lactose, the sugar found in milk. And then the other concern with milk is the potential of contaminants, including antibiotics, pesticides, and hormones, which are heavily used in this industry. Milk substitutes include almond milk, which is made from whole almonds or almond butter and water. And there are a few interesting substitutes that I wanted to mention here that could be really useful. So almond milk is one. It's very low in calories, fat, and carbohydrates. Almonds also contain phytic acid, a substance that bind to iron, zinc, and calcium to reduce their absorption. So just know that if your patient is drinking almond milk or eating a lot of almonds, just know that he shouldn't take iron supplements, or he or she should not take iron supplements. Just know that it will bind to some of the elements and reduce their absorption. So if possible, separate it from meals. Other alternatives could be coconut milk, which contains MCT, medium chain triglycerides, which research suggested may help reduce appetite, assist with weight loss, and improve blood cholesterol levels. It doesn't contain coconut oil, which is saturated fat, and oat milk, another good substitute. It contains beta-glucagon gel that binds to cholesterol, reducing its absorption from the body. It helps lower cholesterol, and particularly LDL cholesterol. And then hemp milk is another one, which is made from the seed of hemp plant, has a slightly sweet, nutty taste and thin, watery texture. Hemp milk is source of 2 essential fatty acids, the omega-3 fatty acids, alpha-lipolenic acid, and the omega-6 fatty acid, linoleic acid. And there's flax milk, which is made from flax seed, which provides the highest amount of total omega-3 alpha-linoleic acid. It is very low in carbs and have 0 cholesterol. And when your patients are consuming alternatives or you're buying alternatives to milk, make sure to avoid the added sugar, which almost all of those products have, unless it's specifically stating that it's non-sweetened. And make sure you read the labels as always. This is my favorite one that I buy for myself and my family. It's called the Good Karma Flex Milk Plus Protein. I like the added protein. It's got protein from peas, and it's got really high amounts, so 1,200 milligrams of omega-3s. It doesn't have any soy or nuts or dairy. It's got really nice amount of calcium, a little bit of vitamin D, iron, vitamin A, B12, phosphorus, 8 grams per serving, per cup, which is really nice amount. And it tastes good, especially if you get the vanilla flavor. And I would say one of the main reasons in my household, we try to limit consumption of milk products, especially milk, is because of the heavy use of pesticides, antibiotics, and the medication in that industry. So if you absolutely just want to drink milk, sometimes goat milk is better, and sometimes organic milk is going to be much, much better as well, much cleaner in terms of the additives.